Okay, so now what we're going to talk about is switching out our breathing circuits. So far we've been working with a rebreathing circuit. We've been working with the coaxial Bain circuit. The advantage of the coaxial system is that as air or oxygen is exhaled, it warms the incoming fresh oxygen and anesthetic gas, which is found in a tube inside of the exhale tube. The inspiration tube is inside of the exhalation tube. Okay? So, as you will learn later on in the course, this also helps reduce something called dead space. The older fashioned version of this was a Y-piece corrugated tubing with a independent exhalation tube and an independent inhalation tube, and what that resulted in is an increase in dead space. So this is an advancement on that design, which reduces dead space and at the same time warms the incoming air. Okay, but what we want to talk about today is switching this out for a non-rebreathing circuit. So a rebreathing circuit, which is what this is useful in that, as you know, it cuts down on the amount of anesthetic gas that we use, and it also cuts down on the oxygen that we use because it recycles the oxygen. So we get to use it as a low flow system. So by definition, a rebreathing circuit is a low flow system, low flow of oxygen. However, it has its disadvantages. The disadvantages is that it's a big bulky contraption. We've got a canister in there. There's a lot going on. So as a patient, you have to push that much harder to exhale into the system. Okay? You can imagine that's not a big deal for a big golden retriever or a Rottweiler. However, if you are a 4-pound Chihuahua, then breathing against this much resistance might pose a challenge because of the amount of force that you have to breathe with. So for smaller animals and cats, we have an alternative, and that is a non-rebreathing circuit. So this is what the non-rebreathing circuit looks like, and we're going to show you how to connect this. So the first thing you want to do is disconnect your rebreathing circuit. So we go ahead and disconnect it from the system. Okay, I'm going to put that aside, and then we're going to come back to our machine and see what we're left with. For the non-rebreathing circuit, we are bypassing this recycling canister. We're not recycling our air, we're bypassing it. We want anesthetic gas and oxygen to go straight to our breathing circuit. So it makes sense that we are going to access the vaporizer outlet. That is the area where fresh oxygen mixes with fresh anesthetic gas and is ready to be breathed by the system. We are going to interrupt the circuit at this point and connect our non-rebreathing circuit right here. Okay, so we've got a couple of connectors on our non-rebreathing circuit. The first one is our gas inlet. This is our gas inlet, and this is the vaporizer outlet. Go ahead and connect that. Okay, you'll notice that our gas inlet is this smaller tube that goes all the way up to our breathing circuit where the patient is going to inhale. Okay. But there's another tube that comes off of this. This is a larger blue corrugated tube, and that tube needs to be connected as well. So that tube is going to connect to our scavenging system. So in this machine, we have a passive scavenging system that is made up of this fair canister. And what we want to do is disconnect the rebreathing circuit from that and connect our non-rebreathing circuit to the canister. We can place the canister back in its little basket behind the machine, or if it's more practical to do so, we can have it lying on the floor on the side where we can work on the pet on the treatment table. Okay? Alright, so that is how it works for this machine. We're accessing the outlet. What I want to show you is how it might look on a different machine. So here's another machine where the vaporizer outlet is actually right here. And what would be ideal would be if we go ahead and get access to this, but as you can see, that is a different connection altogether. Instead, this machine is designed to, if we follow this vaporizer outlet, to come out of here, into here, and then you have access to the vaporizer outlet on the front of the machine through here. Okay? So as you can see, this easily disconnects and this is where we would connect our non-rebreathing circuit. What this is here is the connector for the rebreathing circuit and the canister of this machine. What we want to do is interrupt that circuit and connect our machine, our non-rebreathing circuit here. Okay. So that's an interesting variation on the machine. One thing to keep in mind is that when we are connected to our non-rebreathing circuit, we never want to use the O2 flush. So if I use the O2 flush on a non-rebreather, I am sending oxygen into the pet at the 50 psi, which is very lethal and can be very dangerous. So I can demonstrate that right now by pushing on this, and I can actually feel the air coming out of the non-rebreathing circuit. Okay? I don't want that to be going directly into my patients. So what I want to make sure is that, as a rule of thumb, you never use the O2 flush on a non-rebreather. Fortunately, this machine over here has the added feature of a direct access to the vaporizer outlet. So even if I were to not know what I'm doing and push this button, the air is coming out from the back here, from the O2 flush that has been bypassed, and is not coming out of my non-rebreather. I'm not feeling it there at all. Okay, so some machines are set up like this, some are not. As a rule of thumb, never use the O2 flush on a non-rebreathing circuit. Okay, and non-rebreathers are used in smaller animals under usually about 7 kilograms, and rebreathing circuits are used in larger animals that are over 7 kilograms. If you think about it, a larger animal is going to be using more anesthetic gas and more oxygen during a procedure, so that's when you want to have a mechanism to save on the anesthetic gas and the oxygen. And that is another added feature of the rebreathing circuit, is that we get to save some oxygen and anesthetic gas by recycling it. Okay, and with that we're done with the talk on rebreathing circuits.